Hello, my name is RTB Evan, and today we're going to talk about the 6 rights of medication administration. First, the right drug, the right dose, the right route, the right time, the right patient, and the right documentation. So we're going to start off again with the first one, which is the right drug. We need to ask yourself, is this medication the correct medication the physician ordered? Does the medication label match the MAR? And not so much what's on the actual bag. If you have an IV, you want to make sure that you're actually looking at the drug vial label. Also verify the drug's expiration date, making sure that it's not expired and giving a patient an expired medication. If you're unfamiliar with this medication, definitely do your research prior going in the room, because patients are going to ask you questions about the medication. So get familiar with the drug before entering the room, and you can contact your staff pharmacist in the hospital, or if you're in a facility that doesn't have a pharmacist, you can contact a 24-hour Walgreens at any time. Ask their clinical professional opinion about the drug. The next one is the right dose. Is this the dose the physician ordered? You need to look at any conversions or calculations regarding doses before administering, making sure that the patient can tolerate that amount of drug. The next one is the right route. Can this drug be administered in that route? Whether if it's a IM and you give it IV, obviously IM is going to be a little slower, where IV is more rapid. So you got to make sure that whatever your order is for that route, you need to make sure and follow that thoroughly. The next one, the right time. You got to make sure that, is it time for you to get the medication now, or because medication has certain windows that fall between, say, you can give this medicine every 6 hours, and it's at hour number 5. Obviously, you can't get that medication within that window because it hasn't been enough time for the medication. So, educate your patients on that. A lot of patients really call out for a lot of, say, pain medicines and whatnot. Not that they're abusing it; they're in pain and it's not working. But there's a window that you can only give so much medication in. The right patient. This one's really important. You don't want to give the wrong dose or wrong medication to the wrong person, because that patient may not be able to tolerate it. They may be allergic to it or whatnot. So you need to do your identifications, 2 identifications or more. First off, you can check your MAR, making sure that this medication is ordered for this patient. Walking in the room, you can identify your patient's armband, get them to state their first name and last name, and their date of birth. It's just a step to ensure that this is the correct patient. And it's a new one. They added the sixth one is the right documentation. You need to document the appropriate. Record immediately after giving the medication, which you don't want to wait to document it in the MAR, because another nurse may come behind you and give them more and overdose the patient on whatever drug, because they didn't know that the patient had already received the medication, because it wasn't documented. So it's really important to make sure that you document all your medications, and to protect yourself. Everything needs to be documented in case you need, worst case scenario, court, death, everything, just to cover yourself. And that is all the 6 rights of medication administration. Thank you for watching, and on to the next one.